Thank you for joining us this evening. We're going to go ahead and get started. So this is, first I should introduce myself. My name is Kyle McInnes. I am the founding dean of the School of Nursing and Health Sciences. It is my pleasure to welcome you today. This is the inaugural kickoff lecture of the St. Martin de Porres Center for Health and Human Dignity. And again, thank you. It is an absolute pleasure to have you with us today. I hope you're enjoying this building. If you haven't been in the building at night, it takes on a whole new personality. Our students, some of our students are here, some of our faculty, and some of our trustees and advisory board, and many others, so thank you all. We invite you today to hear the inaugural lecture. Before we do that, it is a pleasure to bring up Father Sicard. It was really his vision not only to have this beautiful chapel behind us. If you have not seen it, make sure that you do. But his vision was, when he became president, to establish a school of nursing and health sciences. And it's absolute pleasure to bring up Father Sicard and offer his remarks.
Thank you, Kyle, and good afternoon again, everybody. It's my honor to welcome you to this formal dedication of the St. Martin de Porres Center for Health and Human Dignity. And today marks a very historic moment in the life and mission of Providence College. The establishment of this center reflects our deepest values as a Catholic and Dominican institution. This will serve as a vibrant hub for scholarship, research, and consultation in healthcare. It will bring together students, faculty, and professionals from across disciplines and across the globe. Together, they will advance a vision of humanistic healthcare rooted in the dignity of every person and guided by the moral teachings of our faith. Though still in its infancy, the center is already gaining national recognition for its leadership in ethical and compassionate healthcare education. This is a testament to the vision behind its founding and to the extraordinary people who are shaping its future, especially Brother Ignatius, and let's acknowledge him. Now, one of the center's most exciting priorities is its commitment to collaboration with the global Dominican family. By engaging with the church, Dominican institutions, and healthcare ministries around the world, the center will help promote faith-based healthcare solutions. It will support underserved communities and integrate Catholic social teaching into the fabric of healthcare practice and education. I want to thank our faculty and staff, students, and community partners present today for your dedication to this mission. May the St. Martin de Porres Center be a place of light, learning, and love for generations to come. Thank you, God bless you, and God bless Providence College.
Thank you very much, Father. It's now a pleasure to bring up Brother Ignatius Perkins. Brother is the founding director of the St. Martin de Porres Center for Health and Human Dignity. And because we only have a half hour, I'm just going to point out one thing in his past. As a 60-year nurse and scholar, Brother recently received the Living Legends Award, one of only 5 in the country in nursing. So, Brother, you are a legend. Thank you for all that you do.
Thank you, Father Sicard, and Dr. McInnes, and welcome to all of you for this very significant historic event. We are pleased to present the St. Martin de Porres Health and Human Dignity Award, but is to publicly recognize and celebrate the contributions of members of the college community and of our healthcare communities in promoting the mission and vision of the St. Martin de Porres Center for Health and Human Dignity. Consistent with the mission of the Providence College and the School of Nursing and Health Sciences and the St. Martin de Porres Center, Dr. Celia Cussen is the inaugural recipient of this award. Dr. Cussen is a Chilean-American professor of history at the University of Chile in Santiago, where she has studied and conducted research on the economic, religious, and social experiences of the African-descended population in colonial America. She is the editor of the Brotherhood of Our Lady of the Candlestick, a brotherhood of mulattoes and naturals, and footprints of Africa in the American perspective for Chile. She is currently researching the global spread of the devotion of Martin de Porres in the 20th century. She has received grants and fellowships from the Hutchins Center for African American and American Studies and the David Rockefeller Center for Latin America Studies at Harvard University, as well as the National Research and Development Agency for the Government of Chile, and the Ford Foundation and the John Carroll Brown Library at Brown University. In addition, she is the editor of El Libro et Cátedra de Nuestra Celia and in Santiago and the Perspectives of Chile. She also was the senior editor for Chile of the Dictionary of the Caribbean and Afro-Latin American Biography of 2016. Dr. Cussen is currently researching the global spread of the devotion of Martin de Porres in the 20th century. So on behalf of the Providence College, the School of Nursing and Health Sciences, and the St. Martin de Porres Center for Health and Human Dignity, we are honored to present the inaugural St. Martin de Porres Minister of Hope and Healing Award to Celia Cussen. Dr. Cussen will now present the inaugural lecture. Welcome.
Good evening, and thank you very much to all of you for coming here, but especially to Dean McGinnis and Father Sicard, and of course, the unique Brother Ignatius, who have invited me here to speak to you tonight, and to Providence community. I've only been here since September, but I have to say I have been absolutely amazed by the warmth of the reception and of the tremendous community that you have here, and the nursing school, which seems to be the latest continuation of a tradition of really respect and interest in human dignity and education. So I'm very honored to be here and by the award. Today we are here celebrating the latest addition to the Ben Mondor Center for Nursing and Health Sciences, the Martin de Porres Center for Healing and Human Dignity. As someone who has spent considerable time studying and writing about St. Martin, I must say how very apt it is that there is a place that has taken his name and that plans to promote his values of humanistic healthcare rooted in Catholic teaching. In this talk on his feast day, I'll speak to the relationship between the values of the center we are inaugurating today, compassionate healing and human dignity, as seen in the life and legacy of St. Martin. Martin of Porres, for those of you who don't know him, died almost 400 years ago, about 16 generations back. He was canonized in 1962, and presumably there are very few people alive today who attended this global celebration of his elevation to the altars of sainthood in 1962. Given that he was not the founder of a religious order, nor was he a bishop or a pope, he left no spiritual writings that might inspire us today, and in fact, he led a quiet and very humble life as a convent barber, nurse, a servant really, in faraway Peru. How is it that today he is remembered all over the world? The answer, I believe, is to be found in the extraordinary, and despite its distance, both in terms of time and space from us, the extraordinarily relatable life of St. Martin. Born in Lima in 1579, Martin of Porres, or Martin, as he's named in Spanish, was the illegitimate son of a Spanish father and an African-descended, formerly enslaved woman. The unequal social standing of his parents and the fact that they never married was not uncommon, but yet nonetheless problematic in Lima, the cosmopolitan capital of Spanish South America, presided over by a European elite very proud of its heritage, but with a large number of enslaved Africans and their descendants and migrant Andeans, and where one's standing and possibilities in life were determined by the conditions of one's birth. The churches of the city literally glittered with the silver obtained from the ore-rich mines worked by the Andean labor gangs high in the Andes, the wealth that sustained the Spanish crown. But locals boasted that more than its gold and silver, the treasure of Lima was its numerous saints. St. Rose, St. John Macias, both affiliated with the Dominican order, St. Francis Solano, and St. Toribio de Mogrovejo were all contemporaries of Martin of Porres. Martin entered the great convent of St. Dominic just a stone's throw from the Viceroy's palace when he was 14 years old, and he served first there as an apprentice and later as the chief nurse in the convent infirmary. But his eagerness to minister to the sick extended beyond the convent walls and into the households and outskirts of Lima, where he sutured gashes, dressed wounds, and contained dangerous fevers, relying on a number of local herbs, including wine, saliva, and even, rather unconventionally, rooster blood. He ministered to the slaves on the Dominican hacienda outside the city and treated, for example, a poor Indian woman who was undergoing a very difficult birth. He was also well known among the elite. Towards the end of his life, he was called to the sickbed of a dying bishop, who, after receiving last rites, called for Martin, famous for his healing abilities, and insisted that this convent nurse place his hand over the bishop's ailing side. With his characteristic mix of humility, obedience, and compassion, Martin reluctantly did as he was asked, and the bishop's pain immediately began to subside. The many witnesses who testified to his life repeatedly spoke to how, in his role as healer, Martin soothed the sick, often by bringing them, for example, a brazier to fight off the famous dampness of Lima's nights, or pulling a fresh orange out from his sleeve as a treat to those recovering from fevers. As a nurse, Martin had skills, experience, but more than anything, an open, generous heart. In addition, in all of these scenes, it's remarkable how little Martin is said to have spoken. Rather, he listened to the concerns of the sick and their families, at most quietly reassuring them of God's protection at the same time that he applied his varied arsenal of medical remedies. Turning first to his compassion and the protection of human dignity. Although from the time of his death in 1639, the devotion of Martin of Porres in Peru never dwindled, it took centuries before his life story and legacy would become known throughout the rest of the world. In many ways, he became known among those for whom his difficulties and life experiences resonated most, beginning, evidently, in the United States. In June 1864, in the middle of the Civil War, African-American members of St. Matthew's Parish, the largest parish in Washington, D.C., approached President Abraham Lincoln requesting permission to hold a festival on a Sunday on the White House lawn, a festival to include religious organizations of every denomination in the cities. Lincoln immediately agreed, and the event served as a fundraiser for the 200 Black parishioners at St. Matthew's who, unable to send their children to public schools and tired of sitting in the back pews of the church, sought to build for themselves a chapel and school, institutions they decided to place under the patronage of Blessed Martin of Tours. Once they were up and running, the chapel, as well as the school for 50 children, would become known popularly as St. Martin's, although he was not yet canonized, until it was decided that the congregation merited their own church, which had to be named for a canonized saint, and thus it became St. Augustine's, a temple in Washington, D.C., which is still very well known, as it was at this time, for the spiritual music of its choir. According to a manuscript by Father Norbert George, a Dominican, the American Dominicans only heard about this fellow Dominican, the saintly Peruvian, when a journalist of the African American press came to the Dominican House of Studies in Washington to ask about him. After publishing his story to evident success, this same nameless reporter returned to the house to ask if the friars had an image of the putative Peruvian saint. Learning that they did not, writes Georges, he suggested, the journalist, that the famous artist in the house, Father Thomas McGlynn, carve one. The result was his first sculpture of Martin, a plaster likeness only 3 feet 8 inches tall. Father McGlynn, who was deeply connected to Providence College and is actually buried on the grounds, his studio has been reinstalled here on campus as well, then decided to do some digging into the life of St. Martin, and he set to work on a translation of his story from a French hagiography he'd run across for the use of Black Catholics in the United States. He was relieved to find that Father Norbert Georges had beat him to the task. I think his French wasn't quite up to it. And he happily contributed a design for the cover of George's translation of the life of the Peruvian, called Meet Brother Martin. Was first published in 1935 and went through at least 16 editions over the following decades. But McGlynn also wrote an article about the life of Martin, which appeared in the Dominican magazine called Dominicana in 1931. Here in this text and in the others that were published by Georges and other Dominicans, he emphasized the discrimination suffered by Martin, the fact that his parents had never married, his humiliation working as a lowly barber in the convent, and sometimes the ill treatment he received as a result. But he also emphasized Martin's compassion for all people, his ability to overcome these kinds of challenges, to spread the faith and the work that he was so well trained to do. McGlynn then left for Italy, Pietrasanta and Tuscany, and we will return to him later. In the meantime, after completing his biography, Norbert Georges learned from a new young postulator in Rome of the causes of Dominican saints that Martin's canonization case had recently been reopened at the Vatican, where Pope Pius XI was said to be very eager to see him canonized for the sake of the African Americans. At the time, there were 12 million Negroes in the United States, as they were called at the time, and only 250,000 of them were Catholics. And the Pope was eager to promote the American Negro Apostolate, as he called it, and give Black Americans greater instruction in fraternal charity. Father Georges, in an unpublished account from 30 years ago, which I've been citing, document was shared to me by the archivist and prior at the Dominican House of Studies, Father Gregory Schackenberg, tells of how he was sent to Lima in 1937. McGlynn took off for Lima, 1937, to learn Spanish and 17th century paleography, which is not an easy task, and as much as he could from the Peruvians about the life of Martin. And there in Peru, he took photographs of the processions, of the devotions, of the images, and the places where Martin had lived. And he used these materials when he got back to the United States to give lectures on the life of Martin in local parishes and other Catholic groups. He says he was then asked by the provincial to run what they called the Blessed Martin Guild in New York City as a publicity organization to promote the canonization cause for Martin. Of utmost importance, of course, were the requisite 2 miracles that would express divine approval for raising the Peruvian to the roles of the saints. But the cause, therefore, had to become widely known. To that end, once in New York, Georges set out to produce statues and print novenas, pamphlets, booklets, and books about the Holy Peruvian. He wrote in this manuscript that he sent out for Catholic directories from Ireland, England, Spain, South Africa, West and East Africa, Australia, and New Zealand, in order to communicate with the Dominican friars in these places, sending out literature then in English, Spanish, French, and some Italian and German as well. Missionaries then carried the message with them to Africa, where, he says, one young convert in Liberia took the name St. Patrick at his baptism. After confirmation, this young African, decided to become a priest, and he left for Ireland to continue his studies. He had taken St. Patrick as his baptismal name. He reportedly in Ireland sought out a statue of St. Patrick, his namesake, and was told by shopkeepers that they really didn't have any, but would he mind taking instead a statue of St. Martin. Martin had become so popular in Ireland by this time. Finally, however, 2 miracles were identified and authenticated, one involving a 5-year-old who had gangrene in the Canary Islands, and the other a Paraguayan woman who had digestive problems and a heart attack in Asunción. So therefore, as a consequence, the Dominicans and all of the enormous number of people who had become devotees of Martin of Porres and had seen him as their intercessor were delighted when, in 1962, he was proclaimed the patron saint of social justice. This was arguably a contemporary answer to a contemporary cry for justice for the poor, the colonized, and those discriminated for their race. A figure who was poor, whose parents were unmarried, who was biracial, who was unschooled. But he was a firm believer in respect and a symbol of respect for human dignity. I'd like to call your attention to the large bronze statue of Martin by Father Thomas McGlynn in 1965. This statue is located in bronze on the Providence College campus just out St. Martin Hall, and it is my favorite among the many, many images that I have come across in my research over 20 years in the Americas and Europe. Here, Martin has the strong hands of a man who lifts and carries, a nurse perhaps, even if his work boots remind us of all the traveling across Lima and its outskirts to collect herbs for his infirmary and make emergency calls to dangerously ill Blacks, Indians, and Spaniards. Nursing, as a Chilean nurse friend of mine pointed out to me, is heavy physical work, hard on the back, demanding of a strong, steady hand. In colonial Peru, and even today among the traveling nurses who treat patients throughout the world, it demands a lot of walking, of finding the infirm where they are, of listening to them, of lifting them or their limbs. The image, I believe, expresses the growing stature of Martin of Porres by 1965, 30 years after these original pamphlets were published, and also, I would say, it shows the growing stature of McGlynn as a sculptor. As soon as Martin was canonized, a series of institutions, sometimes even before, a series of institutions were given his name throughout the world. My poor students in my honors seminar are doggedly looking for places, institutions, schools, parishes, community centers that bear his name throughout the world. Not surprisingly, there are a number of hospitals that are called after Martin. The St. Martin Hospital St. Martin of Porres Hospital in Ghana, for example, states as its mission, St. Martin of Porres Hospital is a Catholic health facility in the Elembel district, committed to providing quality and affordable health care for all people, with special focus on the poor and the vulnerable. We shall achieve this by working with commitment, compassion, and respect, and in the most effective and efficient manner. Established in 1966, and now with more than 700 inpatient beds, St. Martin of Porres Hospital in Taiwan employs 1,500 staff members, including more than 135 full-time physicians, 560 nurses, and other medical staff. And their message states, through Christ's love, enhance quality and dignity of human life, providing modern medical services with compassion and respect. And in the Philippines, St. Martin de Porres Charity Hospital, formerly known as Blessed Martin of Porres Free Clinic, was established long before he was canonized, 1959, as a small one-room clinic in the convent of the Dominican friars in San Juan. And finally, coming from Spanish America as I do, I am well aware of the University of Martin of Porres in Lima that specializes in the health sciences and has almost 8,000 undergraduates enrolled in its medical programs, medicine, nursing, and dentistry. And here in Providence, the Diocesan St. Martin Center just celebrated 50 years of supporting seniors in our city. Finally, as I prepared my remarks for this talk, I was made aware of the recent writings of Pope Leo, who adopted the nationality of Peru, and therefore he is undoubtedly a devotee of Martin of Porres. And perhaps Martin was whispering in his ear when he wrote the apostolic exhortation on the church's care for the poor. He co-wrote it with Pope Francis, of course, but I believe that when they wrote, they were thinking of him when they said how important it is that we see how Jesus identifies himself with, quote, the lowest ranks of society, and how, with his love poured out to the end, he confirms the dignity of every human being, especially when they are weak, scorned, or suffering. Thank you.
Thank you very much for sharing with us the history and legacy of St. Martin de Porres. What a terrific way to launch this center. And congratulations on your award. Congratulations on all the things that you've done in your career. We're so happy to have you here at Providence College, even for this short period of time. Again, folks, I want to thank you for sharing your time with us this evening. And we're very happy to have a moment and for you to talk to colleagues. We have students, faculty, many of trustees are here, and some of our board members, and we have a lot of family, a lot of friends here. Thank you all, and we look forward to seeing you again. Again, God bless Providence College. Thank you.